It's time for another edition of Valley Health Check. We have so many wonderful episodes and podcasts up at mymixfm.com that you can browse through, listen to. I guarantee if you search, there's something relevant to you that you can share with your family and friends and get some questions answered. And that's the whole goal with our friends here at Horizon Health. Now, you can find them at myhorizonhealth.org. You can listen to these episodes at mymixfm.com and plus our Mix FM app. And we have a new guest, a first-timer. I always love meeting new folks here. And Aaron Frank from Horizon Health is going to tell us all about it.
Yeah. Hey, Kevin. We're going to get this one rolling today with Beth Keys. Beth is a pharmacist who works for us at Horizon Health. So, Beth.
Hello.
Hi.
First-timer.
First-timer.
Yes. Have you done a podcast before, Beth?
Never.
So this is your very first one?
Yes.
Well, Aaron gives you T-shirts
can't
and
wait.
Free water.
There's so much excitement.
There's
so much excitement.
Behind the scenes, it's unbelievable. But no, Beth, welcome.
Thank you.
Yeah.
So we're going to talk about the pharmacy side.
Yeah. Tell us a little bit about your background. What's it take to be a pharmacist these days?
Well, I'm a board certified clinical pharmacist.
Okay.
And I graduated from the U of I in Chicago in 2013. And I've kind of worked in all aspects of pharmacy. I've been retail, I've been hospital pharmacy, and then also I've been ambulatory care pharmacy with working with outpatients at the clinics.
Wow. So what I hear there is like you've got a vast experience in this field. That's awesome.
Yes.
Very cool. So today, Kevin, we're going to talk about, I guess I was kind of describing it before we started. So it's kind of like, to me, you're not feeling well, right? And you head into the local super center and you're in that pharmaceutical aisle thinking,
which is daunting.
This is overwhelming.
Yeah. And then half the stuff you have to go to the counter to get because of the ingredients, which I get.
Correct. Yep.
Right.
I get, but it can be overwhelming. So I love that we're talking about.
Yeah. So it's just kind of a where do you start conversation today with over-the-counter meds. Can we frame it like that, maybe?
I like that.
Okay. So we're going to talk first about the viruses, right? So that's where you're probably not feeling well, and if you go to the doctor, they're probably not going to give you anything to help.
Is that it? Viral is pretty much you just have to wait it out, right?
Symptom management is, for the most part, what is going to happen. Sometimes there's a few prescription drugs, but there is a fine line of when you can manage it on your own and when you need to see a doctor. There are certain time frames that we'll talk about.
Well, and I think as healthcare consumers, we've kind of wised up a little bit. The medical community has done a nice job of saying, hey, we don't want to over-medicate you, especially in these viral situations where it's not going to help much. So now I kind of have a feel for, okay, I'm probably going to have to wait this out, but also I feel like poo. So here I am in this aisle.
Is there anything that will help the poo feeling?
Yes. So of course, it's first figuring out how you feel and what it is. Is it a virus? Is it a bacteria? So sometimes you may not know, and you may not need to know, as long as your symptoms are manageable at home. And like we'll talk about here in a couple minutes about there's that fine line, and there's certain types of people that shouldn't need to be a little bit more weary about when they need to go to the doctor. So there's the different viruses, because of course a virus is different from a bacteria. A virus is something that it's a little tiny microbe that requires a host or us as humans to replicate itself. But so influenza, and there's several different types. Yep. There's A, B, H1N1 influenzas. COVID-19 is a heavy hitter, of course. The rhinovirus, which is the common cold. RSV has been becoming more and more prominent. It's more common in younger kids, or it's actually it's common actually in adults, and it's manageable in adults, but the kids, the babies, are probably more problematic whenever we worry about it more then. And then there's the dreaded stomach flu, which is actually the norovirus is a common.
The GI tract.
Yeah. That's the one.
Yeah.
That's not fun for anybody.
That's the one, she says. That's
not fun for anybody.
Yeah. So all of those things then are most commonly we're going to have to hunker down and figure out how to manage it.
Yes.
What's also interesting to me is some of those things, you think COVID, you think flu, they do have tests for those. Is there any value of me figuring out for sure what I have or not?
So it's good to know. It's not always necessary to know. I think that it's most important to know what you're dealing with if you're to the point where you're not able to manage it at home anymore. And then you're talking to your doctor, and that's whenever it's really important to know what they're dealing with. So then they figure out, should we give you this medicine, or do we just have to deal with it and maybe bump up our symptom management?
Well, it's definitely phased, right? Mm-hmm. That's why that's why we're starting in that aisle at the Walmart, right? Yeah. Trying to figure out what exactly we can get there as kind of our phase 1.
So what's nice about going near the pharmacies is that usually there's a pharmacist nearby that can kind of
walk you through
it. If you have a real question of like, I've tried this one and it's not working, and tell them your symptom, and then for the most part they can probably point you in the right direction too. But we can go through some of these that have some good options.
One of the questions I have that I think we'll talk through it all, but is, are there really that many things out there? Like when you see all the labels and all the brands and all the types, but when it comes down to active ingredients, are there really even that many things on the shelf?
There's not. And so the fun part is that there's a lot of combo drugs, which are nice because then you can take one pill or one liquid and it's got 2 or 3 drugs in it. But that's when it also gets confusing, because then you don't really know what you're going for there.
Yeah. Okay, so let's say we're going down this viral journey in the Walmart aisle. My main symptoms are maybe just I feel like I've been hit by a truck. So I've got a bad headache and body aches, no energy. Is there anything out there for that?
Well, what I love for body aches is and headaches would be like Tylenol or ibuprofen.
Okay.
Mainly because it's for pain management, and then also that ibuprofen kicks in some anti-inflammatory.
Question. Is it good to rotate those two?
Yes, it is.
That's what I've been told. I learned that a few years back, and I thought that was interesting.
Well, and adults too? I've always heard that for kids. I guess I've never done that as an adult. I do it for my kids. I don't do it for me. I'm just now having this epiphany right here in studio, folks.
Parents feel like crap, but our kids are taken care of.
My kids feel great.
Yeah, it can definitely be rotated. We see it a lot in the hospital where we'll rotate. And it's a lot of times, in the hospital, it's more because we cannot get the fever down. So then you need 2 agents to get that, control the fever. But most of the time at home, adults likely don't need both. But they're actually 2 different drug classes. Tylenol is different from ibuprofen. The ibuprofens and the naproxens, which is Aleve or Motrin, they're considered NSAIDs. They're non-steroidal anti-inflammatory drugs. And so they're in different classes. So you could take them at the same time and it's not going to hurt you. But it's better if you can rotate them, because then you can take a drug and be more consistent about every 4 to 6 hours.
What about cough?
So a cough, it's all about what kind of cough it is. So cough, there is a dry cough or a nagging cough, which that's better to be treated with something called Delsym, or the generic name of it is dextromethorphan. That actually stops the cough.
Yeah. Okay, dry cough. What other coughs we got?
Okay, so then there's the congestive cough that has you've got gunk down in your chest.
Around,
or it's just stuck and you can't get it out.
Yeah.
So that's whenever you need the Mucinex, or the generic of that is guaifenesin, and it helps get the junk out. So then you can spit it out. You want to spit it out and get it out of your body.
My kids call it green guys.
Well, that's what I first thought of, was those little green dudes.
I mean,
we're out of here.
If you're trying to talk to kids, it does get it. They'll be like, "Mom, I've got green guys. I can feel it again."
Son knew what Mucinex was due to that.
The commercials.
The commercial got him.
Yeah,
that was a good one.
And it did help. For them to be able to tell me that they think that's what's going on is super helpful.
Yeah,
you got to get it out.
So dry cough, mucusy. It could be stuck, or it could be. Is it 2 different things if you feel like it's congestion versus trying to clear it, or is that all the same thing?
I would say that's most of the same thing, but there is something that's also called like a postnasal drip.
Okay.
So that's coming from your head, and it's whenever you lay down, and then you got this big drainage that's going down, and then you're coughing that out. So then you need an antihistamine. So that's where Claritin, Allegra, and Zyrtec come in.
So do you get that postnasal drip in a viral circumstance, or is that you can?
You get that runny nose.
Okay.
Yeah.
That's
Sneezing.
interesting too. I associate all of that with more of like an allergy situation.
And see,
it's the same. Yeah.
Major
Similar.
allergies, which causes coughing, the drip. And
Yeah.
it seems like as I get older, it's more of the kind of the coughing. It's very seasonal. It's certain thing like ragweed. I'm just
Yeah.
But it's all connected.
It is all connected. So viral or bacterial have kind of similar symptoms, where that runny nose, the sneezing, the coughing, and you can have that with if you just have regular allergies.
Okay, so what other symptoms will we have? Does that kind of cover it?
So the other thing that I would bring up would be the congestion in your head. So whenever you're feeling all stopped up in your brain, up in your sinuses is where it's at. That's whenever you really need something more like a Sudafed or a phenylephrine, which those are two different things. One of them you have to buy behind the counter, the Sudafed, and then phenylephrine, though, you can buy out in the regular over-the-counter section. Or I like to use nasal sprays they're steroids. It's the Flonase and the Nasonex. They also help with the congestion up in your sinuses.
This is a little bit of a left turn, but I got to ask, does that mean you've never neti potted?
No.
Me either.
Really?
I
can't do it.
Show host. They go, you've got to try that. What is it, neti pot? I'm like, that sounds weird and illegal. What is that?
That is also good for nasal congestion.
But
I've been neti pots
like,
and the
why do I
saline.
want to do that?
So I first did it only like this season. So this cold and flu season is the first time I've ever done it. And the reason I did it is because my kids did it. My husband tried it a couple of years ago. He's into it. He got my kids to do it. And after my kids did it, I'm like, okay, if they can figure this out, I can figure this out.
You mean with the neti pot type thing?
She was doing it like every day, and I'm like, oh.
Well, what's nice about that is that it's just saline. It's just salt water. So you can't really overdo it. There are medicines that you can overdo.
I mean, that's something I obviously have to work through, but it seems like to me, it's like, put a bunch of stuff up in there. It'll help clear it out.
Well, I just think there are people who know. There are people who know that they're inclined to their sinuses getting kind of stuffed up.
Oh, yeah.
And so it was one of those things where we had kind of been passing it through the family, and I was just starting to feel unwell.
Oh, gross.
Yes, you do. You clean it, you sterilize it.
I know, but I don't know why it's so weird for
Throw
me.
it through the dishwasher.
It's always been that weird.
So, but anyway, I started taking just a couple over-the-counter medicines, and then neti potting. Is it a verb? I feel like this is odd.
Yeah, I think it should
Using the neti pot once a day to kind of make sure that nothing was sitting there, and I never got like full-on sick. And so it did, and I'm prone.
Now you're convincing.
I end up with stuff sitting in my sinuses. Then they get infected, and then I need the prescription. Yes. And so I do think maybe it's going to be kind of a tool for me.
Okay.
Can't really do much harm, maybe it's worth a shot type of a thing.
That's kind of like an over-the-counter.
It is. It's actually not even considered a drug. It would be like a non-pharmacological treatment. Yeah.
Yeah. So you'd put it in your category with like what, your teas?
Your teas, the vaporizers, so like humidifiers and things. So another thing that I wanted to bring up is that with sore throats. So of course there are some nice lozenges for sore throats, like Chloraseptic sprays, which taste disgusting, but they do numb that sucker. Yeah. But non-farm option would be to gargle salt water for a sore throat.
Salt water is so underutilized and has so many more benefits than people realize.
Yeah. You take like a half teaspoon of salt and you put it in about an 8-ounce glass of water, stir it all up and just gargle it back, and it cauterizes those injuries in your throat, and you spit it right back out, and it'll give you some relief for a little bit.
Do you warm the water, or does it matter?
I don't think it matters.
Okay.
I mean, maybe
if the salt had more reaction if it was warmer.
I was going to ask that. So
I don't know.
You did. I wondered. Just as long as there's salt in the water.
The warm might be more soothing.
Yeah, feel better.
I guess that an issue for a lot of people is to know if it is bacterial or viral. But there is over-the-counter for both, right?
Well, so for the symptoms.
Yeah, for the symptoms. But when it comes to bacterial, that's when you probably need a medical professional.
Yes. So most of the time, the body can fight off bacteria or viruses. Most of the time. Well, I guess I should say most of the time if you're not like immunocompromised. So if like there's certain types of disease states that put you in a realm where you probably need to see a doctor sooner than others, like if you have chronic kidney disease, or if you have diabetes, or if you have cancer, and then like rheumatoid arthritis, same things like that kind of lower your immune system anyways, or you're taking medicines that lower your immune system, then you're at higher risk for having more complications from bacteria or viruses.
So those groups of people then that are immunocompromised, let's pause for just a second and give them a little clear direction.
So for the immunocompromised population, I would say, and I don't actually know, I guess I should maybe look this up, but like the fine line of when to go. So for the immunocompromised patient population, I would say if you don't feel within probably a day or two that you're starting to improve, then you need to be getting to a doctor, because that means that the bacteria or the virus is starting to get a little bit worse. But for a lot of viruses, so bacterial infections can hang around longer than viruses. Viruses can usually kick faster than bacteria.
Okay.
So for a virus, some of the reasons why like anybody who is not immunocompromised would decide to go to the doctor is if it's hung around for 10 days or longer. So you kind of give it a long time.
Oh, wow. I never give it that long.
Yeah.
That's a long time. That's a long time, yeah.
Or if you're having an extremely high fever, so greater than 103. So you kind of let it, a normal fever is 100.4 or above. And, but so if you're hitting the 103 range or higher, then you probably need to go to a doctor.
Yeah. Mm-hmm.
Of course, if you're having chest pains, ear pain, especially if you're an adult, because ear pain's a little obscure. It's a little different because kids have ear infections all the time.
Well, and so to pause for a minute, we've talked a lot about viral infections and what those are. Are they your colds? They're your COVIDs. Now we're talking about bacterial infections also. So what are some examples of those? Because it sounds gross, right? You're like, ew, bacteria. I have bacteria building up, but that resonates how? Like, what are the common names that we know bacterial infections by?
So, that's some of the ones that we get vaccinated for. So like the pneumonia vaccine.
Which I'm doing next year.
So that's a Streptococcus pneumoniae infection. I'm trying to think of some. I mean, that's one of the most common.
And
ones. Then there's
it's in your throat, right? Your strep can be bacterial, right?
So strep throat is bacterial.
Yes,
but or it can be. Yes, it's bacterial, but then it's different than the pneumonia in your lungs.
Okay, got it. Both bacterial, just two different kinds. So that's probably the two most common ones that we see, I would guess.
Yeah.
Difficulty breathing is a big reason why you should go to the doctor sooner rather than later. I know whenever I worked in the retail realm, I had like two things on my mind. It was basically if you're having any type of shortness of breath, like if you're feeling labored with your breathing, like you can't get a breath in immediately. You're either going to the ER or you're going to your doctor.
Now, is it okay to talk vitamins here?
Yeah.
I have a big question about that.
Yeah.
Because I'm a big vitamin nut.
Okay.
I take vitamin C, vitamin D, and zinc every day.
Oh.
Every single day.
Yes.
And I started doing that when the first COVID came around because I saw that vitamin D is helpful because you have a deficiency on some of these. And so I've just it's made me feel better. I didn't get sick as often. So I made it kind of a regimen, hoping that was okay.
Oh, it is okay. There are limits, though. You want to make sure that you're not overdoing it because too much of anything can be toxic for your body. Yes.
Okay.
And there are studies out there. I remember learning about some of them that, people would take like crazy amounts of certain vitamins and then it ended up being like a really bad
problematic.
thing.
Yeah.
But I mean, vitamin C, I think it's usually like 500 milligrams once a day. Yeah.
Yeah.
Vitamin C has been studied and it,
well, and I think there are a few different ways to approach it even, too. Like, I give my kids more vitamins during cold and flu season than I do not in cold and flu season.
Really? Well, that's not a bad idea.
Or
just let them fend for themselves during the summer.
Handle it. Yeah. Rub some dirt in it and let's go. Let's go. And then also, when somebody in the family starts to go down, then kind of making sure that everybody's got their regiment
beef up a little bit
in place as well. Yeah. So I'm sorry.
No, you're fine. So vitamin C, it is beneficial. It typically will decrease the symptom duration whenever you are starting to get something going, but it won't prevent it. from happening.
It just makes it.
So zinc is one that I've actually like physically seen people improve on. It may or may not prevent the it's kind of questionable. They've done studies, and there's been some studies that say yes, it prevents, and some studies that say no, it doesn't. But it does also decrease the duration. So both of those are good for illnesses. And then of course, like vitamin D, in my mind, I think vitamin D as being something that's going to be like bone health. Mm-hmm. It's going to help you stay strong and keep calcium going, and it's a good thing.
Okay.
So you want to have that vitamin C and zinc, taking it every day, or at least it sounds like maybe keep it in the pantry.
Yeah.
So the early onset of not feeling
Just
well,
start taking it.
Yeah. If it's going to shorten the duration and things like that, that's super helpful to know. So talking about my kids, can we reflect back on the conversation we've had so far with all the over-the-counter stuff?
Yes.
Is all of that guidance the same for kids?
Okay, so with kids, especially, the younger, little smaller children that aren't like the adolescent age, so not like 13 to 18, but even those ranges, you still have to double check. And anytime that I come across an order that's for a child, I'm always double checking my resources, making sure that their weight matches up with their dose for the doctors and their frequencies, because kids metabolize everything differently than adults do. So always read the label on the back, and there will be recommendations for when you shouldn't use it. So like you shouldn't take ibuprofen for children less than 6 months, right? Which is a big one, because you kind of might forget about that whenever you've had a couple of kids and you already use ibuprofen. Right. But it's less than 6 months. Ibuprofen's not preferred. Tylenol is. And then also on the back of the box is whenever you find their dose and how frequent you can give it to them. I would say that one of the big things that you cannot give any children less than 18 years old would be aspirin.
Okay, interesting.
Aspirin has had can lead to something called Ray's syndrome, and it can be lethal. So we just avoid all aspirin in children.
When you go back to these active ingredients for the other things, though, those are going to line up.
So Tylenol and ibuprofen for children in general is a good idea for fever, headaches, body aches, looking at the age range. Cough and congestion. So I would avoid giving, it's of course you just have to look at what's recommended for cough, congestion, and the mucus buildup. There's not always a whole lot of options out there the younger that they get. So that's whenever you have to look at those using the saline nasal spray for the smaller children, and then you suck it out. And the humidifiers, which are nice for nasal congestion, and then or a steam shower for kiddos that you may not be able to get their congestion up in their head under control. Of course, them not being in the steam shower where you are sitting outside of the shower with your child. But you kind of have to be cautious about the cough and cold ones. Zyrtec comes as a liquid, and it is one that I usually favor for like the antihistamine. So for the runny nose and the
head congestion,
the sneezing, not necessarily head congestion, but the post-nasal drip.
Got it.
Runny nose and sneezing is what I use, the liquid Zyrtec for the kiddos.
Okay.
And
that's actually good to know.
That's very good to know, to have some resources in our back pocket there.
Now, what about the stomach bug? Is there different kinds of stomach bugs? I mean, they all are not fun.
They are not fun. So the stomach is what it's become known as, and it's usually either the norovirus or the rotavirus, but it is not influenza. So the influenza that goes inside your lungs and makes you sick with like coughing and wheezing and things is different from the stomach bug that causes the nausea, vomiting, and diarrhea. So they are different viruses, and neither one of them are fun. Yeah. Yes. Different orifices.
Orifices. We just don't get to use that word enough.
No, like welcome to our orifice.
So my question about the stomach bug is if I'm feeling puny, first line of defense, standing in the Walmart aisle, I feel like there's not things on the shelf for this. There
are, but sometimes, with having nausea, vomiting, diarrhea, that is your body actually reacting to the virus. It's the immune system doing its job and getting it out of you. So
why put anything in when it's going to come out?
It's supposed to come out. But the best thing to do would be to make sure you don't get dehydrated.
Yeah.
So whenever you're vomiting or having diarrhea, you need to drink plenty of water, having electrolytes in it. Yeah, Pedialyte is really good. So Gatorade is typically, those types like Gatorade, Powerades typically have a lot of sugar and not as much electrolytes. So like a Pedialyte is better to look for.
Okay, well, I never thought about that as far as that being a body's response to what you have going on. That's a great point. You think about that, or I think about that a little bit as far as fever. You know, that fever is working to try to get us better and fight things off. I never thought about the puking and pooping as trying to fight it off, getting it out.
It's like, get out of me, yes.
Yeah.
So there are things like Imodium, or I like Pepto-Bismol is a little bit milder, where it just kind of slows it down a little bit. But you still have to be careful because, like I said, you don't necessarily want to completely stop it, but I could understand wanting to slow it, because stopping it means that virus is not getting out and it can build up in your intestines, and that can lead to a hospital stay. So
really good information.
Because
all you want to do is make it stop because it's miserable, but it's a process.
Maybe just letting it slow down a little bit.
But you got to get through it. You got to let it happen.
Yes, yes. And luckily, it's usually, in general, it's usually pretty fast. You know, it's like 24 or 48 hours. So making sure you get plenty of rest, plenty of water intake, and then a brat diet. So a brat diet is where you try to only eat bread, rice, applesauce, tea, or toast, and those are all very mild. You know, so the saltine crackers, trying to get a little bit of those, the chicken broth, or, you know, the chicken noodle soup, something that's going to be easy on your stomach, because if you have a high fat or a high sugar, it's coming right back.
Poke the bear. You're poking the bear.
Yeah.
Poking the bear.
In the bathroom.
Anyway, okay, great. That's super helpful. The last category we had on here was pain management. And we have a few different episodes that you can go back and hear that are about pain management. Quite a few. They get into some niche things as it has to do with pain. But I just thought, while we're talking about the over-the-counter availability of medication management, I thought maybe this one was worth throwing in here.
Yeah. So, of course, with pain management, pain is a very difficult thing. Sometimes, you know, luckily a lot of people have it just like temporary pain. Some people have really chronic pain where they need to go to the doctor and try to get something figured out that's more like definitive. So with back pain, sometimes with back pain, if it's more localized in like just your lower back or something like that, Salonpas or that have a lidocaine in it, a lidocaine type patch or a lidocaine rub can be good because it just kind of numbs it, makes you get a little bit of comfort, even just doing it right before you go to bed or something like that so you can rest. Of course, with back pain also, with any of these actually, Tylenol and ibuprofen. Naproxen is Aleve. Aleve is nice because it's longer acting. It's twice a day instead of like
and it seems
4 times a day.
Yes.
Yeah.
Well, and I guess that's why I value this question too, is because there are so many things that are branded as particular pain busters. So there's all of these labels out there that are for migraines, and then there's the labels that are specifically for period pain, and so
arthritis,
right? And so at the end of the day, how do you kind of cut through that noise of marketing? I guess,
because there's a lot of
and figure out, you know, what do I need to be looking at on these labels?
So acetaminophen, that's your Tylenol. Yep. And that's probably the most common pain reliever. And it's in each one of those items that you just listed off. So they may market it, but you don't have to buy, you know, something that says back pain and something that says migraine. Right. If it has acetaminophen, a 325 milligrams or a 500 milligram tablet, that is what you're looking for. Even if you just buy the generic one that doesn't have anything branded for it. Yeah. That's acetaminophen. Then that's great. Sometimes it's easier. Sometimes the marketing is for like the gel caps or the tablets.
Right.
So some people do not like those long tablets sitting in their mouth and they can't swallow it. Right. So they prefer the gel caps. And those are usually a little bit more expensive, but they're easier to get down for some people.
They might work better for you.
And there's value in that, certainly, understanding what you're going to be able to take or not take. Or I still have a kid who's only liquids. You know, they're a little bit too old to be only liquids, but we're only liquids still. So it happens. Yeah. And then I find what happens is as you try to buy non-kid medicine in a liquid, that price goes way up.
Oh, yeah. Mm-hmm.
That price goes way up. It's interesting to me.
Yes. So then there's headaches, which of course headaches are nice. Tylenol, some people don't get any benefit from Tylenol, so they use ibuprofen more often. Ibuprofen, like I said, is a little bit different from Tylenol because it's anti-inflammatory. And just making sure that you're not taking too much of it. Right. So there is such a thing as a rebound headache. And a rebound headache is when you've taken too much of your pain medicine.
Interesting.
For a headache. So if you've got a headache and you're taking, headache medicine every single day, then you're actually causing yourself to have those rebound headaches because you're over-treating yourself. And that would be a reason to go to a doctor and get like a prescription drug because you're having too many headaches.
Causing more problems.
Yes, you are.
Than you need.
And that's actually if you have more than 2 headaches or you're treating your headaches more than 2 times a week.
Interesting.
Okay.
Yeah.
That is interesting.
Yeah. Well,
I might have over-medicated before.
Yeah. Well, and there is a whole nother podcast specifically on migraine management. That's something that's really evolved. Mm-hmm. And, now you have all kinds of medication options, non-medication options. So if you're here today for the migraine management, I would encourage you to go listen to that as well.
And then there's the period pain and cramping that can happen. So once again, the ibuprofen and Tylenol. There is the Midol that has a combination.
Is there like a
in
pamphlet?
Oh, is that what Midol is?
Mm-hmm. It's got 3 different drugs in it.
Well, that's interesting. I didn't realize that it had 3 different meds in it too. So there could be some value there.
Yeah.
Interesting.
Yep. And then arthritis pain, there's a lot of options out there for arthritis pain. Tylenol is usually first line. Ibuprofen is a good one, or of course, the naproxen like we keep talking about. Aspirin also would be good because those NSAIDs have anti-inflammatory, and arthritis is the inflammation of a joint. So trying to control that inflammation is nice, and then also with that pain relief. But there is also something called it's a cream. And it's called capsaicin, and it's more for the knee, but it has to be applied 4 times a day, and it causes some burning sensation at first, but you get past the burning sensation, and then, it really does start helping, and it's a nice over-the-counter. And then there's also some topical NSAIDs, so if you don't want to take a tablet because you worry about your kidney function or anything, then Voltaren or diclofenac is a topical cream that can be put onto the joints as well.
And all those are still over the counter?
Yeah.
Oh.
Wow.
I didn't know there were that many over the counter cream options.
Oh yeah, there's a lot of them. You just have to kind of know where you're going with it.
Where you're going and what you're, always ask your pharmacist.
Yep.
I mean, that's what we'll go back to. If you have any of these questions, they're happy to help. I mean, surprisingly happy to help. As you get older, you're not afraid to ask those questions.
Yeah.
I have a great relationship with my pharmacist.
Yeah,
excellent.
That's good. That's how it should be. That's how it should be. That's how it should be. So, in wrapping this up, is there anything we didn't cover? Is there anything you see that you try to debunk along your way?
I guess one of the things that I would point out is that with the pain medicine, at least, so there's always certain populations that shouldn't take certain medicine. So it's not a bad thing, especially if you're an advanced age person, then it would be an okay thing to maybe just discuss it real quick with your doctor, because they know what's going on with you, with your disease states, because liver disease or a poorly functioning liver, Tylenol is not always recommended, or you really have to cap that dose at a lower dosage whenever you do need a Tylenol. And then if you've got poor kidney function, then those ibuprofens, naproxens, and aspirins can be harder on your kidneys and actually make it worse. And then also those non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are not always wanted for patients who might have heart failure or coronary artery disease.
So many different medications are suitable and not suitable. It goes back to the conversation with your doctor, your pharmacist.
I feel like, Kevin, a lot of our podcasts have this theme to it, but this is what we do if we need to manage something. Ideally, we can prevent it. So we talk about that a lot in our more
like preventable
chronic management discussions, but that's true here too. So what do we need to be doing?
So one of the major ways that we pass around viruses and bacteria is by touching surfaces and then touching your face. So if you touch your mouth, your nostrils, or your eyeballs, after you've touched a surface that's infected with like influenza or a bacteria, then you're just inserting that right into your body.
Taking care of the middleman yourself. Right there.
I feel like this is another opportunity to use the word orifice. So you
out of your orifices.
Keep it out of your orifices. I'm just saying that word doesn't get enough use. So don't touch your face. That's a good one.
Don't touch your face, and use hand sanitizer, an alcohol-based hand sanitizer or soap and water.
Yeah.
Always have hand sanitizer.
No, I like it.
That's good.
Yes.
That's good.
I also wear baseball gloves so I don't touch my face.
I think that the not touching your face, though, honestly, after your kids are old enough where they're not putting their hands in their mouths, you kind of forget about that. But those teenagers are constantly picking at this or touching this. I feel like I kind of need to get back on my soapbox with that one, probably.
If there's one thing I take out of COVID, is to quit touching your face, Kevin.
Yes.
Yeah.
Seriously, I was adamant about it, and I was adamant about washing my hands, and that has stuck with me.
Yeah. That's great. So we've got all the management tips. We've got the prevention. Thank you, Beth.
Yeah, Beth, for your first one, boy, you threw out a lot of great information. I think a lot of questions were answered within this segment. And you know what I always say, share it, download it. There's someone in your life that can benefit from this conversation. And I don't see why it wouldn't. Do it today at mymixfm.com. Our friends at Horizon Health, they got a great medical staff there, and you can take advantage of all that they have by listening to these podcasts at mymixfm.com, our MixFM app. And Beth, for your first podcast, bravo. You did a wonderful job.
Thank you.
Great job, ladies. Thanks for being a part of this.
Thanks, Kevin.